In southwestern Arizona, where the Colorado River crosses the international border into Mexico, there are two communities which are separated by the border wall: San Luis Rio Colorado in Mexico and San Luis, Arizona. In addition to having close ties and a shared history, these two cities share something else in common: a University of Arizona College of Nursing alumni who has spent the last several decades improving the lives of individuals in both places.
¿Qué pasó, Olga? Pues te voy a ver ahí, ándale, siéntate ahí, mira. I'm the oldest of 5 children. We immigrated to the United States when I was about 17 years old. I went to school here in San Luis Rio Colorado, to elementary school and high school. And then I went to college in Yuma, Arizona, when I was 18. And then when I was doing my nursing assistance course, the same teacher, and I don't remember her name anymore, but she told me that I should become a nurse. And from there, I took a little sideway and I went to seminary. Well, I have an associate degree, obviously, from college, and then a bachelor's degree in nursing from the California State University, Los Angeles. And then I have a master's degree from the University of Arizona and a master's of divinity from the seminary. And then I have my doctorate also from the University of Arizona, which is in nursing. I always loved the University of Arizona, even when I was in college. I heard about it. I never been to the University of Arizona. When I saw my professors, what they were doing with their research, what they're doing with their community interventions, how they have created new healthcare systems, new health delivery systems, I thought, oh, this is something that I could do in the place where I am, which is the U.S.-Mexico border.
As a nurse practitioner, Dr. Valenzuela maintains 2 clinics, both of which he helped found on each side of the border. The clinic in San Luis, Arizona, which is now managed by the Yuma Regional Medical Center, where he sees patients, and the Clínica Santa Maria de Guadalupe, where he now has become the CEO and chief administrator, and which is sponsored by the Friars of the Sick Poor of Los Angeles, the religious institute to which Father Rudy belongs. In addition to his work with each clinic, he also maintains his priestly duties with his parish in San Luis Rio Colorado. He will cross the border to work with both communities several times over his average 13-hour day.
It looks hectic, but it's not really that hectic. I get up about 6 in the morning. By 6:30, I do my prayers. 7:30, usually have breakfast, and then I leave after that to the clinic in San Luis, Arizona. And then from about 8 to about 3 or 4 o'clock, I'm at the clinic. And then I come home, have lunch, if I have time for that, and then I go to the church. Either to the clinic here in San Luis, Mexico, or to the church, depending on what I'm doing. And then there, I usually check, whatever we're doing in the clinic, if they need anything. And then after that, I usually have Holy Hour, and then we have Mass. I usually have meetings that go on depending on the day, 8 o'clock, 9 o'clock. And then I come home, usually rest a little bit, do my prayers, and then go to bed. I'm usually in bed by 10.
The Clínica Santa Maria de Guadalupe started as an agreement between the Friars of the Sick Poor and the local Catholic bishop to help the poorest individuals in San Luis Rio Colorado obtain access to quality health care. But once Dr. Valenzuela began working on it, the need became evident.
So we came down and we opened the clinic. We opened the doors. There was a doctor there for 4 hours every day from Monday to Friday. We saw about 2,000 patients the first year. Next year we saw about 5,000. So it started increasing a little bit as we became better known. And I think that one of the keys to success on the increments of people that we were seeing, first of all, was that we provided quality care to the poor, which it may be an unknown concept because people tend to believe that the poor do not deserve the best quality of healthcare. But we were providing that, and we were providing low-cost healthcare. And it was comprehensive. Everything from medical service to lab to pharmacy to psychology. We had a dentist. We still have a dentist. And all of a sudden we boomed. I mean, we started seeing 13,000, 20,000, 30,000 people a year.
Realmente hay muchas personas que nos vemos beneficiados con el servicio que nos brinda la clínica. A mí en lo personal me ha servido mucho a mí y a mi familia porque está al alcance de nuestro bolsillo poder acceder a estos servicios y cerca y en un horario muy accesible desde muy temprano hasta muy noche, todos los días.
We expanded to a new building that is probably probably 5 times larger than the one that we had for 10 years. So we overgrown the needs of the old building. We built a new one within like 3 years.
I can't call it a clinic, it's a hospital, and the number of patients they treat and for what they charge, it's just amazing. It's just they charge nothing and provide the great service.
And now we see about 50,000 patients a year, but we have incremented our hours and our services. We're open from 8 o'clock in the morning to 9 o'clock at night every day of the week, including Sundays. We have a low-cost access, which is 50 pesos. Right now, the rate will be about $2.75 to see a doctor. I think that one of the main concerns is that the population has grown so fast, it has outgrown healthcare systems and infrastructures. So both governments, either government, both in the United States and in Mexico, are not prepared to deal with the health of growing populations at the pace that they're growing. Poverty is another big issue. You know, people who do not reach a certain level of economic independence are not gonna look for health care first because they're busy making a living. So you have people who are really poor who may be diabetic, but they haven't seen a healthcare provider. So we're gonna find diabetes at a later stage. Same with cancers of any different kinds. We're gonna find, and it's statistically proven, that we find cancers on poorer people at a later stage than people who are economically independent or who have insurance, because they don't have that kind of early access to healthcare where they can do preventive care.
Y a pesar de no tener yo la situación económica muy fácil, aquí se me brindaron todos los servicios y me ayudaron muchísimo. Y no solamente en salud me ayudaron, sino emocionalmente. Muchas personas de aquí, de esta clínica, me dieron mucho confort emocional.
While he is careful to keep his priestly duties separated from his nursing duties, being able to see his parishioners on a regular basis allows him to check in on their health.
When I'm a nurse practitioner, I'm a nurse practitioner. And I think it is implied by the way that I talk to them, or by the way that I counsel them, or by the way that I care for them, that I'm also a priest. Ay, no, que la vida es bien frágil. La vida es bien frágil. Tiene uno que tener cuidado. It's the same when I'm a priest. I mean, when I'm a priest, I'm a priest. But intuition tells them that I care for them in a different way. That is probably more holistic than just spiritual. I do care about their well-being, their physical well-being, and my parishioners. I ask them, how's the treatment for your diabetes going, and at least give them advice or turn them back to their doctors and say, you need to follow up on this because this is important. And I will encourage people to join nursing, first of all, because I think it's one of the most noble professions that there are. And we're versatile. We can do so many things. We can work with patients in a hospital setting. We can do community health. We can affect the health of one single person, or we can affect the health of entire communities, of the whole country if we want and set ourselves to it. We can dream as big as we want, and we can accomplish those dreams being nurses.